Okay, a lot of trends in America and all around the world are started in Hollywood, and diets are not included in that. One of the diets that's really trendy right now is gluten-free diet. It got really hip a couple years ago, and a lot more celebrities are trying out the diet. And I work at Hope Hospital in Newport Beach, and where people can afford a lot of trendy things. And when they're in the hospital, they like to take advantage of the dietitians on staff, and they like to try out new diets, especially gluten-free diets. One thing that is kind of amusing to me is that a lot of the patients don't actually know what the diet is. They just think that it will help them lose weight, and they don't even know what gluten is. They just want to try it out. They've seen it in the tabloids or what have you. So what usually happens with me, I go to patients' rooms and help them pick out their meals and deliver their trays, and I go between the dietitians and the patients. And some of the patients pretty much demand a gluten-free tray, and so we bring it up, and none of the food is looks appealing to them, or it's nothing that they're craving. So when you explain it to them, they want to be taken off the diet. It's not something that they want to eat. You ask them, okay, you want to be gluten-free? They're like, okay, bring me an English muffin and oatmeal and everything that they can have. So what I want to talk about is about what the gluten-free diet is, and who should go on it. And okay, so according to glutenfreeville.com, this diet is really trending now, obviously. A few facts about the gluten allergy. It's also called celiac disease. There are about 40,000 Americans that are currently diagnosed with it, and then about 1 in 133 have it, so they don't know. Also, another thing is that going on a gluten-free diet is like a one-way road. You can't just go on it and get off it once you lose the weight, because your body's going to have changed a lot by then. It's also, celiac disease is also a lot more prevalent in European countries, and mostly in Ireland, where about 1% of the population actually has the disease. So this is what you've probably seen in a lot of grocery stores. There's sometimes in some stores whole aisles dedicated to gluten-free products now, and this is mostly because it's hip. So a lot of people get this done. I'm going to talk about the symptoms for children and infants. Actually, for both people, they'll get diarrhea just because you can't absorb the protein. Everything's pretty much just washing through you. You won't be able to keep weight on. Adults are usually anemic, and pretty much you're just wasting away. There's not, you can't keep any of the food in you, and you have to eat way more food than a normal person just to get a tiny bit of protein. The idea here is that your body's not absorbing the protein, and I'll show you. These are villi in your intestines. The villi, your intestines belong to inside. They're like finger-like projections to all over the inside of the intestines to increase the surface area so that your intestines can absorb protein. This is a healthy villi on the cross-section. And then here we have basically the villi can't absorb the protein. It kind of just tears the intestines apart, and the protein's just kind of leaking into the blood system, and it's really painful. A lot of people just live with it, and they have no idea really what's going on. So some of the other symptoms. A lot of these symptoms are they can be generic, kind of, like people don't really know what's wrong with them. They just feel like something's off. You have to get a lot of blood work done, and sent to a lab a lot of times so the doctors can figure out what's really wrong with you. A lot of times it's not diagnosed until either later on in life or until you just run out of things to try. So people who should go on a gluten-free diet are people who are actually allergic to gluten. They can't absorb the protein in their body. And the gluten is like a part of the protein in, it's in barley, rye, wheat, and oats. Dietitians use the BROW acronym. So basically you have to avoid these foods depending on the severity of your disease or like your personal condition. You may have to cut out corn or cornstarch, or it depends on your personal condition. So those are people who should actually go on a diet. If you're just looking to lose weight, then you should try just to be more vegetables or something. Because most people who are on this diet, they can only eat meat and vegetables and fruit and rice flour, and their diet's a lot more limited than people know. So I hope that is enlightening about this diet that I don't really need to go on, so just to be aware.
All right, Mark, what did you think?
I thought it was a really good speech. Her thing was about gluten, and her thesis was about gluten and who needs it and stuff like that. And I really like that she used her like personal experience and about her working with people who want to be on that, and then also the reference to how people who want to be on it are just wanted to do it just because of the media. One thing I did think that she should improve on is where she got like most of the information from, like all the stats and stuff like that, like where it came from. And I really like the visual aids, especially the one about the intestine, and I didn't know that. So I thought it was overall good speech.
All right. Well, I'll agree with you on the visual. I thought that the one with the intestines and the villi better explained what it was that you were talking about. I think you could use a little bit more follow-up on that, explaining exactly what the process is and how these allergies work versus, you had a name for the disease and you mentioned it a couple times, but I think your voice dropped out both of the times that I heard it, and so it was a little hard for me to put a label on that. You've got an interesting backstory that you're using as kind of your attention device, that this is a popular diet that seems to be trendy. People are requesting it in the place that you work, but they often don't understand what it is that they are getting involved in. And that's where I think that you need to have a slightly clearer focus on what you're going to do. You're going to explain what a gluten-free diet really involves and why it is that anybody would ever need this sort of diet. The preview was partially setting up the secondary claims. It did seem a little short, and then internally I'm not sure that it's as well organized as it suggests it's going to be in the preview. There were some transition segments that you did label, but sometimes you're relying on the slides to do all of that for you. Early on you had an early quote about this particular issue, but it ended up sounding like a paraphrase, and I think that you need to be more consistent in citing information in the presentation. Like I said, I like the one slide talking about the villi. Thank you. That's the way you want to say it. All right. I also like the BROW acronym and the way you explained it, how that's going to have the things that people have the allergies to. Statistical information got dropped in here and there, and again, I think that that needed to be organized a little bit better. On delivery issues, On delivery issues, you want to get the pen out of your hand, your pacing needs to be a little bit quicker, and your voice drops out quite often, and that's something that you want to be more consistent on. You need to project a little bit more and be consistent about that projection. All right, thank you.